Hello, this is Alexis May for AI Med, and today I'm excited to be joined by a special guest, Dr. David Gruen, Chief Medical Officer, Imaging at IBM Watson Health. David, welcome.
Thank you very much for including me.
Thanks, and it's great to have you with us. Now, David, I just wanted to start off today by asking you about IBM Watson Health's response to the ongoing global health crisis. What are your key areas of focus right now?
So, we live in uncharted times, and I think IBM has responded like any great and giant and resourceful company would by taking the best of what it's good at and bringing it to bear in a time when it's most needed. So we've pivoted, of course. We're not sending people out into the field the way we did. So the first thing is, of course, we're taking care of our employees to protect their health and safety. But we're bringing together a whole mess of resources to manage the outbreak with what we do best, applying data, knowledge, computing power, and insights to solve unheard of and difficult problems. As you know, IBM is first and foremost a great technology company, and we're leveraging that technology know-how in the healthcare space. So some of our broader initiatives, we're giving researchers free access to the supercomputing capacity of IBM. We're providing detailed data and virus tracking on the Weather Channel. We're supporting healthcare organizations, governments, and scientists who are working tirelessly to fight COVID by providing this kind of data. Our AI-driven Watson Assistant is providing fast and accurate answers around COVID-19 for customers, employers, physicians, citizens, whoever needs it. What else are we doing? IBM Clinical Development is using AI to reduce the time and cost of clinical trials. Really important. We're trying to find solutions and get them to patients as quick as we can. And IBM Watson Health Micromedics, in conjunction with Dynamed, is providing online point-of-care resources for drug and disease info around COVID. And finally, of course, at a corporate level, as part of the consortium, IBM is providing massive computer power to research solutions to try and address the clinical challenge of COVID-19.
Wow, that is an impressive list of activities, David. Thank you for sharing. Now, our main focus today in this conversation is looking forward to the AI Med Radiology meeting on the 20th of May. For which IBM Watson Health are a key partner. Now, we're delighted to have you on the speaker faculty for the event. Could you share a very brief teaser overview of what you're going to cover on the day?
Yeah, I'd be delighted to. So it goes without saying, Alexis, that we are living in unfathomable times. And this talk has definitely morphed over the past week since we first talked about the conference, and now since it's changed from a live conference to a virtual one. When it was first scheduled, like most practicing radiologists, I was spending my clinical days cranking out cases, putting out fires, and really trying to keep focused between the daily interruptions that practicing radiologists face on an hourly basis. With that as background, I had planned to discuss the epidemic of physician burnout, a burnout largely due to a mismatch between the amount of work that we need to do, error-free of course, and the ability to get it done in a 24-hour or a 36-hour or 48-hour workday. And I believe now, as I do now, that AI offered really important and real solutions to help address some of that. Of course, the world has been turned upside down since the course was planned, so I thought it was really important that the presentation reflect this moment at hand upon what has changed and what remains the same. So if we think about burnout as a mismatch between what has to be done and what can be done, we still face burnout. It has not gone away, but some of the mismatch and some of the drivers have changed, and we're going to address those. At IBM Watson Health, we're working every day to address the many conceptions about AI and what it could do to us reading physicians. I really believe that now more than ever, we need to think about what AI can do for us and with us rather than to us. And those are going to be some of the topics we're going to talk about.
Indeed, and we look forward very much to hearing from you on the 20th of May. David, just to finish up here, from the attendee perspective, we'll have people coming in from all over the world now. We're a virtual event, which is a great benefit. What's the main takeaway you hope the meeting will provide for attendees?
So I would say in a nutshell that radiologists, that relationships matter. And radiology, as most of us know, it was built on the shoulders of person-to-person relationships. That was clinicians coming down to a reading room, and I say down because it was always in the basement near central supply in the cafeteria. Clinicians would come down to discuss a case, to discuss a patient, to collaborate about workup, and the next day they'd come back to discuss the results of the prior day's tests. Well, PACS changed all of that 20 years ago. Radiologists and clinicians started interacting with machines instead of with each other. And the field's never been the same. It's ironic and perhaps sad that the current crisis we're living may be the defining moment for AI, when people cut through the hype and see AI, artificial intelligence, for what it was always meant to be, which is a new set of tools with capabilities that support clinical workflows to save time and effort, to let physicians focus on what's really important to them, to making fewer errors, to taking better care of patients, to being more actively engaged in patient care on a day-to-day basis. And so those are some of the things we're going to talk about at the conference.
That's wonderful, David. Thank you for that. I couldn't agree more strongly with the sentiment. Thank you so much for joining us today. Thanks to everyone for watching as well. As ever, please do make sure to like, share, and subscribe. And you can register to attend the AI Med Radiology meeting on the 20th of May at ai-med.io. Thank you.
Alexis, thank you. We'll see you in a couple of weeks.